Hello everyone. So today's topic is cholera. As we all know, it has caused a lot of pandemics in past and is a cause of acute diarrheal diseases. Okay. So directly going into its epidemiological determinants, talking about agent. Okay. So the causative agent here is Vibrio cholera. The epidemic strains known of Vibrio cholera are O1 and O139. Now O1 can be classical type or LTOR. Now LTOR is different in many ways. One of them is it has higher epidemic potential. The other thing is it has no susceptibility for phage classical phage 4, and it has no sensitivity for antibiotics like polymyxin. Also, it agglutinates with the chick embryo, uh, chick erythrocyte, sorry. Okay, so these are some feature we differentiate LTOR from the classical type of Vibrio cholera, and there are then three serotypes of them: Ogawa, Inawa, and Hikojima. Ogawa being the most common in India. Now, else than these epidemic strain, we have non-epidemic strain, also known as non-cholera vibrios or non-agglutinating vibrios. Now, these are also found to be pathogenic in some ways, like Vibrio parahemolyticus, which causes a diarrhea. So these are not completely non-pathogenic, though they are known as non-epidemic strains. Now these cholera are killed at 30 within 30 minutes at 56 degrees Celsius, plus at 37 degrees Celsius they are killed within few minutes. Okay, and they are susceptible to drying and sunshine. Also, using bleaching powder 6 milligram per liter instantly kill these vibrios. Okay, and they release a toxin that mediates its action through adenyl cyclase CAM pathway. And one of the most important thing is that it only acts on small intestinal cells, nowhere else. Now humans are the only reservoir of vibrio. They act as case as well as carrier. Now the case secrete the number of vibrios in a high concentration, that is 10 to the power 7 to 9 vibrios per gram of stool. But the important thing is 75% of cases of Vibrio cholera are asymptomatic, and these are the main source of spreading infection within a community. They shed the infection for 7 to 14 days after they are infected. Okay, so these asymptomatic cases are what we need to aggressively search for. The symptomatic cases present with clinical features of Vibrio cholera. Now the carrier secrete these vibrio in a small concentration of 10 to the power 2 to 10 to the power 3 vibrios per gram of stool. And for detection of carrier, we use a technique of purging the stool by giving 30 to 60 milligram gram of magnesium sulfate. Now the infective dose for a normal person is 10 to the power 11 vibrios. Okay, so this is what is the infective dose. Period of communicability differs on the type of carrier. Now incubatory carrier sheds the organism for 1 to 5 days, since incubation period ranges to 5 days. Now convalescent carrier are one which after the treatment secrete the bacteria for 2 to 3 weeks. Okay, these are a result of an inadequate antibiotic therapy. Now chronic carrier are, we see that their gallbladder is infected and they may shed organism. The longest case was about more than 10 years. Now contact and healthy carrier are result of subclinical infection of Vibrio cholera which secrete the organism for 10 days. For detecting these carriers, we use an enrichment media and then we detect these in the culture. Talking about the host factor, it can infect any age, any sex. Now the most important host factor is gastric acidity, as we should know that Vibrio cholera are susceptible to pH less than 5 or equivalent to 5. So this gastric acidity does not allow Vibrio cholera to invade the intestinal mucosa. Population mobility is an important factor which regulates the Vibrio cholera epidemics. Now, immunity lasts only for 2 to 3 months in case of infection of cholera, so that is not that much significant. Talking about the environmental factors, a poor environment um, promotes the promotes cholera infection. Contaminated water and food do so, and human habits of contaminating water and polluting the environment contribute also in this. Now, mode of transmission is fecal-oral. Okay, through most common being through the contaminated water. People uh, have people spreading the infection to the nearby pond, lake, and then do the other people use that water. That helps in the spread of the infection. Incubation period of Vibrio cholera ranges from uh, few hours to 5 days, but normally it is within a range of 1 to 2 days. So this is what we needed to know about determinants of cholera. Thanks for watching.